Hello and welcome to the Answers for Cancers podcast. I am your host, Anne-Marie Fay.
And I'm Michelle Matthews.
Together with some of Ireland's leading experts, we want to unravel what it truly means to have cancer.
From consultant diagnosis to treatment plans, from managing your symptoms to supports available, we have it covered. So whether you're a nurse working in oncology or have been personally affected by cancer, this podcast is for you. We are so lucky to be joined by two special guests on the podcast today, Monica Conway and Claire Kelly, to cover the topic of lymphadema after cancer. We have split this episode into two parts, so be sure to check them both out. These two incredible women have extensive experience helping people to recover after a cancer diagnosis and beyond. We first became aware of the amazing work that they do when we started following their Instagram pages, and their passion was immediately evident. They work tirelessly to provide care for those in need, and they understand some of the challenges lymphedema can cause, and they want to help improve people's lives and outcomes. We could do a whole podcast based on their experience and expertise alone, as they work, volunteer, chair and run workshops. Today they walk us through how to calculate our risk score, and we will discuss the cornerstones of lymphedema, including skincare, compression, exercise, risk reduction strategies, and we also discuss the psychological impact a diagnosis of lymphedema can cause and how to acknowledge and address this. Thank you so much to Claire and Monica for the incredible work that they do.
Good morning. Welcome to the Answers for Cancers podcast. Monica, we're delighted to have you here because we've been trying to organise this for a long time, so we feel very privileged to have you with us today. And we might just start, if you don't mind, just if you can tell us just a little bit about yourself and what you do.
I'm Monica Conway. I'm a lymphedema therapist, and I went on and studied a master's about 10 years ago. And I have my own clinic based in Clonmel, County Tipperary. And that's basically it.
Brilliant. So we might just start with starting with the basics, and if you could just explain to us what the lymphatic system actually is, if you don't mind.
Okay, so the lymphatic system is basically it controls the balance of fluid within the body. So you've got your circulatory system, and its first cousin is the lymphatic system. That's how I explain it to my patients. And the main vessels run all beside each other, parallel to each other. So your vascular system, the arteries take the fluid, nutrition, oxygen to the tissues, wash around the cells, but that fluid has to be taken away. So that's taken away by the lymphatic system. So you've got your deep lymphatic system, which is around your main organs and your gut and your inner organs. And then you've got your superficial lymphatics, which is basically drainage at skin level. So the function of the lymphatic system is really, it's your immune system. It's to fight infections. It's to filter any dead cells that are in the body. You know, if you got a bruise or whatever, those dead cells have to be taken away. Mm-hmm. They're taken away. And viruses, bacteria, and it also destroys any mutant cells like dead cancer cells, etc. So on a daily basis, the average body drains about 3.5 to 4 litres of fluid into the bloodstream at the neck. So all the lymphatic system, it comes up through your body. Let's say starts at the legs, up through the groin area where you've got a big cluster of lymph nodes, then up through the abdomen, and then up through the chest, and it enters the bloodstream at the neck on either side, and that's where you drain about 3.5 to 4 litres of clear fluid per day. As the lymphatic system doesn't have a heart like the vascular system, it relies on other external factors to allow fluid to move. So pulsing is one of them, and that's why the lymphatic system lies parallel to the arteries and the veins. So the pulsation of the artery pushes some fluid through. The second thing is just under your diaphragm, you have what we call the cisterna chyli, which is a reservoir. And there's one-way valves the whole way through the lymphatic system, the same as the veins returning to the heart. So when you take a deep breath in, or you cough or sneeze or lean forward even, it empties that reservoir, the cisterna chyli, and pushes the fluid on up. So that's why deep breathing is really important, or abdominal breathing is really important for moving fluid. But the biggest factor of all is movement. Mm-hmm. So when you pump your muscles, that moves the fluid from the tissues and pushes through the lymphatic system. And that's the main function, or that's the main way that the fluid is moved through the body, is through the muscular system. The fluid it's a clear fluid. So that's what it looks like as it enters the bloodstream.
It's amazing to think what the lymphatic system does, and we're not even aware of it every day, how much it's working.
It's so good to talk about it, because this will really help patients, I think, because it's like knowledge is power, and if you can understand what it does normally and what the function is, then it makes more sense when something is maybe acting a bit abnormal, like when lymphedema occurs and something like that. So thanks so much. That was a really good explanation, and even in my head it makes much more sense as well. So thanks so much for that. I suppose we might just touch on lymphedema now, and if there is there any different types of lymphedema?
Yeah, there are two types of lymphedema. There's what we call primary lymphedema. I'll just touch on that briefly. Primary lymphedema is where the lymphatic system is malformed. Shall we say. It's usually a genetic condition. There may be too many vessels, too few vessels. There may not be any valves. And as a result, they can develop a swelling in an area of the body, usually a limb. There's three different types of primary lymphedema. There's the congenital type. So when the baby is delivered, the baby will have a swelling at birth. Then there's the second type, which is in usually late teens. It's usually somebody out playing sports. They twist an ankle, maybe running, playing rugby, whatever. And the swelling doesn't go down. And then they leave it for a while, and then they may go to a doctor, and they've discovered that, hopefully they discover that they have lymphedema, and we can get early intervention, which is what it's all about. Then there's a third type, and that happens around 30 to 40 years of age. And that's, again, swelling just appears. And the lymphatics basically have been struggling for years. And then something small, what we call like an insult to the lymphatics, we call it, can cause the lymphatics to just kind of stop working or slow down. Then there's secondary lymphedema. Secondary lymphedema is caused by an injury to the lymphatic system. So if you can imagine where your lymphatic system is, let's say you're looking at an arm, and maybe you had surgery and accidentally the lymphatic pathway gets damaged. And as I say, the road is closed.
Right.
Okay.
Yeah.
So when the road closes, you get a little bit of a build-up of fluid. Same with the leg, if they could have just maybe a motorbike accident, it could be, and they get injured on that side and it gets damaged. The second reason usually is the most common form, which is post-cancer treatment. So for instance, if I talk about a breast cancer patient, they may have a lymph node resection. They may just have a sentinel node biopsy done. Even a sentinel node biopsy can cause lymphedema. Somebody could have 28, 30 lymph nodes removed and never develop it.
Yeah.
So there's no hard or fast rule as to who develops it or who doesn't.
Okay.
And would you consider somebody that has got a sentinel lymph node biopsy at the same risk as somebody that may have had maybe an axillary clearance of their lymph nodes?
Personally, I think that if they had axillary lymph node clearance, you will monitor them closer.
Yeah.
They're the larger cohort, but again, you could get the odd case where they could develop it even after a small biopsy.
Yeah.
The same as, I had a lady come 21 years post mastectomy and lymph node clearance.
Wow.
And she developed lymphedema then. Yeah.
Wow. Okay.
So there's no hard or fast rule. Basically, it can happen at any time.
And are we right to say the most common sort of cancer surgeries that you might experience that are breast, prostate and kind of gynae? Is that fair?
That would be fairly fair to say, but also head and neck.
Okay, yeah, of course, yeah.
Head and neck is probably the highest. It's around 50%. Roughly, the figures vary, but it's about 50% of head and neck patients are at risk of developing lymphedema.
And is that because what you were saying earlier, it drains from the neck? Is that's
partly the reason, but the other reason is because, which I didn't mention earlier, is radiation has a big impact as well, and so does chemo. But radiation, it can damage the initial lymph vessels and even deeper. So that can bring on lymphedema as well. So if you've had lymph node resection and radiation and chemo, your risks are increased.
Okay. And are there signs and symptoms that people should be looking out for with regards to lymphedema?
Yes, if you're looking, let's take an arm for instance. The first thing they usually complain about is they'll feel maybe a tingle through the arm. Tingling usually is the first sign. And then they may start complaining of feeling heaviness. But at that stage, there may be no swelling.
I'm thinking because with a lot of breast patients, they'd be on chemotherapy drugs that can sometimes cause tingling in the hands and things like that as well. So it might be hard to differentiate if there's no swelling, I would imagine.
Yes. Yeah. It is difficult to differentiate, but you just have to monitor and you need to educate your patient so they can monitor themselves.
Yeah.
And that's why we're here today doing this podcast.
Yeah, exactly. Absolutely.
So that they can keep an eye on it. It's no harm to do a couple of measurements, maybe take a point from the elbow and do maybe 10 centimetres below and 10 centimetres above, and just one at the wrist and one at the top of the arm. And the patient will know where, or the lady will know, they're not patients at this stage, they will know where to measure because they're doing it regularly, just to keep an eye on it.
And if they start to notice an increase in size, then that's really when they should be going to get some intervention. Is that fair?
Absolutely, because that's what we call subclinical, and that's when you can most of the time prevent it from developing.
I suppose just recapping on the most common signs and symptoms that you mentioned there, Monica, is it tingling initially that can be with or without swelling, and then obviously the swelling that is most commonly known about lymphedema. And is there anything else that you think would be another sign and symptom that would be initial?
Yeah, they can have heaviness in the arm as well.
And that can be with or without swelling as well?
With or without swelling.
Okay, perfect. I suppose moving on from signs and symptoms, we know that there's different stages that can be mentioned when lymphedema is present. Would you be able to take us through the different signs or different stages?
Yeah, there's basically there's actually 4 stages. Stage 0 we call it. There's a couple of different scales of definition of stages of lymphedema, but in Ireland we tend to stick with the international framework guidelines. So stage 0 is what we call the subclinical, and that's where you've got the tingling, the heaviness, and but there's absolutely no swelling at that stage. Then you've got stage that stage is where you really want to see the person, because then you can check their shoulder movement, check that they're doing some exercise programs and moving the limb.
And is that the same now? Sorry, I'm just thinking lower down as well.
It's the same, exactly the same.
So if you notice like tingling in the leg or heaviness in the leg as well.
Absolutely.
Okay.
Yeah.
Brilliant.
The heaviness in the leg, definitely. They'll probably feel the heaviness in the leg quicker at an earlier stage than they will in the arm.
Yeah, I feel like you can attribute more to like a heaviness in your upper body because you noticeably feel like you do more with it. So I imagine, with your legs, if they're heavy, it's really it's easier to identify.
Yeah.
God, my legs feel really heavy, where it can be harder with your upper body. But it's really good to know that that's the key stage, if possible, to see people at 0.
Then stage 1, which is they have very mild swelling. You just might be able to get a little bit of what we call pitting. Pitting is where you put your thumb and hold for a minute or two and see if you can get an indent. And that's important for people to be able to do that themselves, so that they can see if there is fluid in the tissues. Just pushing your thumb down and taking it away again isn't going to do anything. You're not going to push the fluid out of the skins to see if there's, to get an indent. So it's important to be able to do a pitting test, and I think all cancer survivors should be taught how to do that, just to keep an eye on it, again, like the measuring of the arm. They'll find that the leg might feel heavy or the arm might feel heavy and swell a little bit as the day goes on. But when they get up in the morning, there's no swelling. So that's what we call it, the swelling reduces with elevation. And then stage 2 is where there's definitely more, swelling is there. They can feel it. They can see it when they look at their limb.
And would that be more of a permanent kind of swelling? It would last longer than
There's no reduction at night in a stage 2. And then the stage 3, which is, you don't want to see people at stage 3. That's when they're really advanced. And thank goodness We don't see too many of them.
Thank God.
Thank God, yeah.
And I'm just thinking of elevation, because it's the first thing, if somebody injures themselves or they injure an ankle and they can see it swollen, you just think to elevate it. Is that the same with lymphedema?
It is in the early stages of lymphedema. If you elevate, you do help to reduce the swelling. But as it progresses on and the fluid becomes thicker within the tissues, elevation isn't going to have any impact.
Okay.
Because that fluid becomes rich in protein.
Right, okay.
Within the tissues, and that's what it gets harder and harder, and then you get what we call the real hardening, which is stage 3.
Okay.
Luckily, we don't see too many people at that stage, and that's where it's fibrosis has developed, which is hardening of the tissues.
Fair enough. Okay.
And I suppose that would be considered one of the complications, I suppose, is hardening of the tissues. Is there any other complications associated with developing lymphedema?
Yeah, well, of course, one of the complications is poor mobility. If they have it in their limb or even in their arm, and they have their shoulder isn't moving to the ability that it used to.
Yeah, I had a lady very recently saying she's really struggling to type, and she's out of work now because of it, because she hasn't been able to type as efficiently as she would have been before.
Yeah.
Gosh. That's so debilitating, isn't it? My goodness.
Yeah. So it can have an impact, I suppose, if it's not treated.
Yeah, but you see, in cases like that, you need to get ergonomics.
Yeah. Yes, exactly.
Involved and come up with a solution.
Yeah.
Because you want to get people back to a normal life.
Yeah.
Always.
Absolutely.
And that's always been my goal. Yeah. When a patient comes in, I ask them what are their activities?
Yeah.
What do they normally do, and what used they do? Like playing golf.
Yeah.
Doing whatever, going hiking. My aim always is to try and get them back to doing what they were doing before.
So important.
No matter how sick they are.
Yeah, absolutely. Yeah. Yeah.
So important.
Even if they have to go in a cart playing golf.
Yeah.
So what?
Yeah.
Yes,
they're out with their friends.
Right. Yeah.
They're doing things that they love and enjoy.
They have a quality, yeah.
So other complications then is the infection cellulitis. And cellulitis, if you, let's say you're out gardening or you're doing something that is where this involves maybe some bacterial, like working with soil or whatever, and you don't have lymphedema, a cellulitis infection, which is a skin infection, can actually bring on lymphedema. Okay. But if you have lymphedema, as I stated already, the fluid within your tissues, especially if it's there a while, in other words, you've got quite a bit of pitting, the fluid is rich in protein. So you injure that skin, it becomes a petri dish or a basis for growing infection.
Yeah.
And of course, because the limb is swollen, the immune system response within that limb is reduced. So it takes longer for your body to fight the infection, to send the macrophages and the lymphocytes and all the little cells that come along and gobble up the infection.
Yeah.
It takes it longer to get in within the limb. So as a result, you can have an infection manifested fairly advanced by the time that the immune system is able to respond.
Right. Okay.
Yeah.
Okay. Gosh.
So cellulitis is one of the problems. And how to recognise it is may feel unwell before they even realise that the limb is red. So a flu-like symptom, raised temperature, the skin is red, and it is really red and hot to touch. And I tell people that if that happens, they go straight to their doctor immediately. Okay. You don't wait till the next day.
Yeah, absolutely.
Yeah.
And would you see that more commonly associated with like maybe stage 1 or stage 2?
Stage 1 and stage 2, not really.
Not really. More stage 3.
It's more stage 3.
Yeah.
Okay.
Yeah.
Okay.
Yeah.
Fair enough. There's an example I always think, I'm trying to remember, is it from home ec or when I started oncology training, but if you're sewing, to always wear, like, to protect the fingers, because if you prick them like that they can get damaged, and it can trigger cellulitis and lymphedema. Is that right? Am I getting that
Absolutely.
somewhere?
Yeah. No, you want to protect the skin.
Yeah.
So we could touch on that now. Things to prevent lymphedema. That you can do.
Yeah.
Things that can help. So skin care is really, really important. So that's involves where you get cuts, grazes.
Yeah.
Just clean it and put a plaster on it. keep it covered until it gets better. But
And
keep
clean
an eye on it.
with like it's kind of saline, or should you use like an
It doesn't really matter.
It doesn't matter, does
It
it?
doesn't matter.
Okay,
Once you use an antiseptic,
perfect.
yeah,
Good to know.
bit of Germaline or
Perfect.
whatever. I
Yeah.
don't like using a
Brand.
brand name.
Yeah.
Yeah, I just say to people, just use an antiseptic and
Perfect.
it'll be fine. When they go out in the sun, to make sure they wear a sunblock. But if they have lymphedema, of course, they're going to be wearing their garment, compression garment. So
It's protected by
it's
the garment
protected
as well.
anyway.
Yeah.
Yeah. But you know, sometimes if they're in a very light garment, they might need to put a little bit of sun cream underneath.
Perfect. Yeah.
Another thing is to avoid shaving the legs, of course, because you
Yeah.
don't want to cut the legs with a razor blade.
Of course. Yeah.
So they can use an electric razor instead.
Yeah.
Okay.
Yeah, and that solves that problem.
Yeah.
And it's important to moisturise daily, wear gloves when they're gardening. Other things that can help is weight management. It's actually phenomenal when people lose weight how their lymphedema improves.
Wow.
Unbelievable. They can go they can reduce litre, 2 litres, 3 litres in a limb.
My
In a leg,
goodness.
in a large leg.
Yeah.
And the lymphedema becomes so much more manageable when they lose weight. Of course, exercise. These are the 4 cornerstones. Exercise as well, and of course, any form of movement is going to move the fluid.
Yeah.
So, any form of exercise. Aquarobics is absolutely fantastic. Walking. You can do pole walking. Swimming is amazing.
Is it? Yeah.
And aquarobics is absolutely fantastic because you're getting two components there. You're getting the movement within the water, plus you're getting the hydrostatic pressure under the water.
Oh, amazing. Yeah.
Wow.
Yeah. So that's really fantastic. And of course, then another thing they can do to help is self-lymphatic drainage. And there's quite a few videos available, but I would recommend here in Ireland, I would direct people to a particular website, and it's the National Lymphedema Framework Ireland.
And we'll share that on our social media. I've actually looked into it. It's a really, really good website, really good resource. And
No,
for healthcare workers as well, actually.
It's for healthcare workers, it's for healthcare professionals, and it's for patients. We're still adding quite a bit of information to it, so it's not fully completed yet.
And you're directly involved in the website as well, are you?
I'm part of the committee.
Yeah.
Brilliant.
Yeah. And then another very important thing is that if people are looking for therapists,
Yes.
that they find a qualified therapist. So it's fine within the HSC. We know that everybody's qualified, but outside the HSC, where in private practice, you need to make sure that you're getting a therapist that's trained to divert the fluid.
Yes.
That's a fully qualified lymphedema therapist,
Okay.
not just a lymphatic drainage therapist.
Okay.
Yeah.
Okay.
That's good to know.
And to identify a fully qualified therapist, you go on to a website called www.mldireland.com.
Brilliant.
And there you'll find about 50 or 60 qualified therapists.
Great. We'll be sure to definitely share both of them.
Yeah, that's great.
And the videos for, the manual lymphatic drainage, they're on the first website.
They're on the NLFI.
Brilliant.
You go in and you'll find the videos there for self-lymphatic drainage for an arm, for a leg. It's all very well explained.
And how often should people be doing the manual?
Well, it depends on how swollen. If they have a swelling, then it's better if they do it daily or every second day. The more often they do it, and especially the deep breathing.
Yes.
And the breathing exercise program is in there as well.
Brilliant.
So all that is there.
Brilliant.
That's great.
And just for the people that are they don't have lymphedema yet, but like we said, they may be at risk of developing lymphedema. Like maybe people have undergone breast surgery and have had a sentinel lymph node biopsy. Is there anything that they can do to prevent developing lymphedema, or any tips that you would, or anything that they can avoid, I suppose, that can help prevent?
Yeah, things to
lymphedema?
avoid. I don't like giving the negative sides of things, but I think it's important that people to understand that, it's important to know what helps, but also things to avoid. The one thing is getting a sunburn. Yeah. That's very important. Extreme heat or extreme cold. So in other words, going into a sauna or a steam room is not advisable.
Okay.
because it has a direct impact on the lymphatic and the vascular system, and the same with the cold. Cuts and grazes, as I said already, just making sure they look after it. Then the other thing is, when they're in hospital, they may have blood pressure taken to try to avoid that arm if possible at all. And the same with taking blood samples. Stay away from the affected side, and taking your blood pressure. But other than that, you know, if they want to go for a spa day, yes, of course they can. They can go for facials. They can do all those lovely things. They can still go into the jacuzzi.
Oh, that's good. That's nice to know.
Yeah. Well, I always tell people you can go into the jacuzzi, but just be sensible about it. Don't have the jet blowing on your affected area. You know, and the same, even the hot tub, you know, the lovely hot tubs that sit outside, they're only about 30 degrees. They're only like the same as a shower.
Lovely.
So there's no reason why you can't go into those. But again, if it's your arm, just pop it up outside of the jets. And don't have the jet blowing in under your affected side armpit area.
Such practical tips. Like, it's so nice to know that people can still do these things.
Do all those things.
Looking at it,
but you know, it's actually the practical tips that aren't spoke about a lot, and they can actually be so life changing for people when you just tell them what's good, what's bad, what they can and can't, what's advisable and what's not. You know, it can really change somebody's life, really. You know?
Now, people do get a little bit worried when they do exercise that the limb looks as if but all our limbs swell a little bit afterwards. Because you've increased blood flow, so you've got more fluid going into the tissues. So people get a little bit worried because they're looking at the affected side. They don't look at the other arm, but of course the other arm is the same.
Fair enough.
So, you know, but that's only a transient thing. As soon as the body temperature settles down again, that arm will come back to normal. So they mustn't worry about exercising and the arm getting larger or anything like that.
Brilliant. And can I just double check? I know we briefly touched on the compression garments. Who should kind of, I suppose, go and get fitted for them, and where should they get fitted for them?
What I say is people are best to go, if they feel they need a garment, they need to go to a qualified therapist, because they need to be assessed first. Do they need a garment or not?
Okay.
If they're very concerned and they may be taking a long haul flight and they're a bit worried, it might be no harm to put them into a sleeve, but it doesn't have to be really, really tight.
Okay.
You know, a class 1, which is a lighter compression. But then I always put people into a glove as well, just to be on the safe side, because you don't want their hand to swell when they have a sleeve, you know, just a sleeve on.
Yes.
Especially if they're flying, because when the decompressed pressure within the cabin, it can trigger it. But doing their exercises when they're on the plane, moving their arms, that's really, really important. About compression garments, you know, they need to go to a qualified therapist to assess them. They may be okay if it's only a mild lymphedema to go in what we call, there's different types of garments, to go on to just a normal off the shelf garment, as we call it. That's they come in, you know, all different sizes, and you just fit to the closest size that patient will need.
Okay.
But then if people have a bit more of an advanced lymphedema, you will put them into a custom-made garment, which is specifically made for that person. And then, of course, if they have very advanced lymphedema, I put them into a wrapping system as well.
Okay.
So they use a wrapping system at night, and they use the compression during the day. That works really well.
Brilliant. And I suppose important to be kind of guided by a qualified therapist as to how long to wear them, when to wear them, and all
it's usually just during the day. Take it off at night.
Okay.
Yeah.
So we've just got a couple of questions in from our Instagram from a couple of different people about lymphedema. So one particular person has some mild lymphedema post breast cancer treatment, and the question is what's the optimal amount of time for wearing compression during the day? Is it 10 to 12 hours a day or from the time you get up to the time you go to bed? She's getting quite conflicting advice at the moment. What would be your opinion?
Well, my opinion would be she can wear it, especially when she's exercising. Try and wear it as much as possible during the day. But when she sits down and relaxes in the evening, definitely take it off.
Okay. That's good to know. So there's no set time of 10 to 12 hours. It's really just...
No.
Perfect.
But definitely she needs to wear it while exercising.
Perfect. And then if she's just moving around during the day or going to work or going to the shopping
she should
centre,
really wear it.
She should be wearing it.
Yes,
Grand.
absolutely.
Yeah.
Because she doesn't want anything. I gather she's a fairly early stage.
Yeah.
She doesn't want it getting any worse.
Yeah, perfect. And another part of that question is about advice on the types of compression garments that you can get. She's only been able to see tan ones in Ireland. Is there any other options available for people?
Yes, yeah. If she gets onto a lymphedema therapist, they'll be able to direct her to companies that sell some beautiful tattoo type
Brilliant.
garments, sleeves, and
they are available.
They are available in Ireland, yeah, but they may take a little bit of time because they may need to be ordered in specifically.
Okay, and they can only do that through a lymphedema specialist.
Yes, a lymphedema therapist should be measuring her for her garment anyway.
Perfect, that's great. And there was a couple of other questions around cellulitis. Michelle, I might get
Yeah,
into that.
absolutely. So if people are starting to get cellulitis more regularly, is there, I suppose it's starting to progress. So maybe they would have had it once and now they're starting to have it 2, 3, 4 times.
Yeah, that's something I see.
Yeah.
I see in clinic. It's more common in the leg than in the arm for a start, which is interesting because the arm, you would imagine, because they're using their hands all the time.
More with it,
but it is more common in the leg. Recurring cellulitis, again, they should see a lymphedema therapist who will examine them thoroughly, find out what's causing. It could be something very simple, like for instance when they're putting on their sleeve, that they're accidentally just very fine scratch on their skin that they barely notice, but it may be enough to introduce infection.
Okay.
They may not be washing their sleeve often enough. There could be a whole host of reasons. The other thing is, what moisturizer are they using? Are they moisturizing? Because keeping the skin in good condition is vital.
Of course.
And of course, one of my pet hates is when patients get cream out of a tub.
Oh.
And especially for the legs. It's, from my experience, it's one of the most common causes of causing cellulitis in legs particularly.
Wow.
Something I would have never thought of,
Never.
to be honest, but
So-
I presume it's because you're dipping in and out, is it? Okay.
Yeah,
Wow.
cross-contamination.
Never
Yeah.
ever would have crossed my mind.
Yeah.
Right.
Yeah. There was a study done on it actually in one of the London hospitals, just when I was doing my master's. But the paper actually was a grey paper. It never got published,
Okay.
which was a shame.
Yeah.
And I did get access to the grey paper, and it was peer reviewed, but the peer review were looking at the cream
Okay. Right.
as opposed to, but there were some conflicting opinions.
Okay.
And in the end, it was definitely the cross-contamination.
Cross-contamination.
So I tell all people that they should use a pump action bottle.
Perfect.
Okay, and then for cellulitis of the legs,
Yes.
which is the most common, in my opinion, you look at the causes again, and one of the main causes is using cream from a tub. The second cause is very mild athlete's foot infection.
Right.
Which is actually quite common, isn't it? Athletes'
Very
foot infection.
common.
Yeah.
And especially in lymphedema patients,
Okay.
for 2 reasons. One, if they have swollen toes, which goes with lymphedema, there's no space for air to get in between the toes, so they're more at risk of, and especially if their feet are swollen, they're at more risk of getting athlete's foot. That tiny little break in the skin will cause recurring infection.
Right.
And so that's one of the other reason, of course, is the cream, as I said.
Yeah. Yeah.
So it's very, very important. Sometimes you'll barely see the infection there. It's just if you look between the little toe and the second toe, or the fourth toe, isn't it? The little toe and the fourth toe. You'll see a little red line,
Okay.
and that's enough to trigger.
And that's enough to trigger the
Now,
cellulitis.
the antibiotic protocol.
Yeah.
Often the patients that develop cellulitis aren't put on antibiotics. Maybe sometimes not the correct antibiotic.
Okay.
Because it's a skin infection, the international guidelines state that it should be flucloxacillin, 500 milligrams 6 hourly.
Okay.
Okay. and they need it for 14 days because, as I explained already, within the limb, the immune system is slowed down. Everything is slower getting into the limb, so the infection is slower coming out of the limb.
Makes sense, yeah.
So for somebody that has lymphedema, that's developed cellulitis, they need flucloxacillin 6-hourly for 14 days.
Correct.
Yeah.
And if they're allergic to penicillin, the guidelines state Clasit or clarithromycin. Yeah.
Brilliant.
Yeah.
That's so good for patients to be able to advocate for themselves now if they're only given a script for 7 days.
Correct.
Because I think, as we were mentioning earlier on, sometimes it's just 5 to 7 days. They're not given the script for 14 days. So this is fantastic.
And the thing is, it's sometimes the infection can sit there, and then it'll raise this little ugly head maybe 2 weeks or 3 weeks later.
Yeah.
And then they're back on antibiotics again. Yeah. Same pattern again a few weeks later. They're better off to get their 14 days, get it over and done with.
Brilliant.
And then it's sorted.
That's great.
And Monica, just before we let you go, because I want to get the most out of you today because you're so knowledgeable, you mentioned a couple of practical things that were really useful there, and one of them was about using a pump moisturiser instead of a tub, which actually is really practical and a really good tip. Is there anything else, I suppose, hygiene-wise that you would recommend for people to do at home to prevent any risk of infection?
Yeah, I suppose to use pump action for shampoos, hand washes. I think most people are using them now anyway.
Yeah.
But it's
just to be conscious of it.
to be conscious of it. Yeah.
Brilliant. And they're the best things to help prevent infection at home.
Yeah.
Brilliant.
And then, Monica, do you mind just telling us some of the best online resources that patients can go to, or healthcare professionals who are at risk or have a diagnosis of lymphedema, or also where they can go to find a registered lymphedema therapist?
Yes, the first place is to go to the National Lymphedema Framework Ireland, and that website is www.nlfireland.ie. And then to find a registered therapist who's trained in lymphatic drainage and decongestive therapy. They're not just lymphatic therapists, they're specially qualified to treat cancer patients and how to divert the fluid, because it's really important that the fluid is diverted in the correct direction. And there you will find therapists on www.mldireland.com.
Excellent.
And we can't stress how important it is to ensure that they're going to a registered therapist.
Correct.
For their treatment. Yeah.
Brilliant. And we'll be sure to link those two websites as well on our Instagram page and
Thank
in
you
the
very
bio
much.
of this.
Yeah, some of the psychological aspects of lymphedema really need to be acknowledged. For instance, a patient that's had breast cancer treatment and ends up with lymphedema, and they're wearing a sleeve and possibly a glove. Because their hand is in front of them all the time, and it could be 20 years later, they still have that constant reminder of having had breast cancer. Also, other psychological aspects are finding clothes that can fit and that they feel comfortable in. And it's the same even with the leg cancer patients.
Yeah.
They might be able to get a nice pants to wear. They can't wear skirts anymore. And it's, if they have a big wedding coming up.
Yeah, absolutely.
It could be a son or a daughter getting married, and they have to go and get a trouser suit for the wedding. And
I always hear people say, sorry to interrupt you, but they're saying, I need to find something that's going to cover this arm. So it's the first thing they're thinking of before they're even thinking of what they like to wear. They're just like anything that will cover, which must have a huge impact.
Psychologically. Psychologically, yeah. So they're just a couple of little aspects of the psychological
impact, which is really important to mention. So thanks for touching on that.
Because as you said, it's constant when it's in front of you all the time. Even if your cancer is gone, you can still see the lymphedema, which is so challenging. This is fantastic. Thank you so much for your time today, Monica. Thanks for listening to the Answers for Cancers podcast. Please share this podcast with anybody who you think it might help. Also, if you can like and subscribe, it lets people know we're here. You can alternatively contact us on Instagram at the Answers for Cancers _podcast. And if you have any questions on anything that we discussed today, please email us at the answersforcancerspodcast@gmail.com, or you can DM us on Instagram.